Welcome to another short from the Vet Med Digest. Today, we dive into canine hypothyroidism, which is simultaneously the most common and most overdiagnosed endocrine disorder in dogs. This condition is characterized by a reduction in thyroxine hormone production and influences the function of almost every organ in the body. Most acquired cases result from lymphocytic thyroiditis, an immune-mediated destruction, or idiopathic thyroid atrophy. The clinical presentation is notoriously broad, frequently involving signs of a decreased metabolic rate such as lethargy, mental dullness, and weight gain. Dermatologic abnormalities, including bilateral symmetric alopecia and a dull coat, are reported in up to 80% of affected dogs. Less common, but critically important, manifestations include neurologic signs like ataxia, generalized weakness, and hind limb paresis, which are strongly associated with the disease. Laboratory tests often reveal hypercholesterolemia in about 75% of hypothyroid dogs. Furthermore, hypothyroidism induces oxidative stress, marked by decreases in antioxidant activities like superoxide dismutase and catalase, coupled with elevated concentrations of malondialdehyde. Confirming the diagnosis presents a major challenge. Total thyroxine, or T4, serves as a screening test because it is highly sensitive, but lacks specificity. A low T4 alone should never be the basis for a definitive diagnosis. Acute systemic illnesses cause non-thyroidal illness syndrome, suppressing circulating thyroid hormones. If testing is necessary during acute illness, measuring free thyroxine by equilibrium dialysis is recommended because it is less affected. If the patient is recovering from acute illness, thyroid function assessment should be postponed until 2 to 4 weeks after discharge for accurate results. Additionally, drugs such as glucocorticoids, phenobarbital, aspirin, and sulfonamides can significantly alter thyroid hormone concentrations, potentially mimicking hypothyroidism. We must also consider life-threatening concurrent conditions. Dogs with hypothyroidism and gallbladder mucoceles face an especially poor prognosis. Hypothyroidism increases the risk of gallbladder rupture by 4.1 times and the risk of death by 4.4 times compared to dogs without endocrinopathies. For these high-risk patients, elective surgical removal of the gallbladder should be considered. Treatment, usually involving oral levothyroxine sodium replacement, is typically straightforward once confirmed. Owners often observe a rapid improvement in activity and mental dullness within weeks. Treatment corrects hypercholesterolemia and improves the disturbed redox balance, leading to significant improvement in oxidative status within 45 days. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging,